My name is Mohsin Rashid. I am a pediatric gastroenterologist and professor of pediatrics at Dalhousie University in Halifax, Nova Scotia. I also volunteer for the Canadian Celiac Association. We will be addressing an important question today, and that is what to do if you have already started a gluten-free diet without confirming the diagnosis of celiac disease. Before we do this, a brief introduction to celiac disease might be helpful. For some of you with good knowledge of celiac disease, this introduction may seem very basic. But for others with limited knowledge, this information is essential. Celiac disease is a condition in which the ingestion of gluten, which is a protein present in grains including wheat, rye, and barley, causes inflammation and damage to the lining of the small intestine by an autoimmune mechanism in genetically susceptible individuals. This can lead to a variety of symptoms and the inability to absorb nutrients from the diet. Celiac disease is a very common disorder affecting about 1 in 100 people. It can present with a variety of symptoms, both off the bowel and outside the bowel. Some of the bowel symptoms include chronic abdominal pain, diarrhea, vomiting, gas, and bloating. Symptoms outside the bowel include skin rash, mouth sores, anemia, joint pain, fatigue, weight loss, and many more. A person may have one or more symptoms or no symptoms at all. There are highly effective blood tests available to screen for celiac disease. The one used most commonly is IgA tissue transglutaminase antibody, in short called TTG test. The diagnosis of celiac disease is confirmed with a biopsy, which is a small sample taken from the intestine by endoscopy to demonstrate inflammation. The treatment of celiac disease is a strict gluten-free diet. After starting the gluten-free diet, the symptoms resolve, inflammation in the intestines goes away, and the celiac blood tests become negative. The timing for this varies between individuals, but if gluten-free diet is followed properly, this will happen. So you have started a gluten-free diet without the TTG test or a biopsy. It is important to note that just because you may be feeling better with the gluten-free diet does not necessarily mean that it is celiac disease. There are things in wheat other than gluten that can cause symptoms. Some people may have a wheat allergy or irritable bowel syndrome, which is aggravated by certain types of carbohydrates in wheat. Celiac disease is a significant disorder that requires a strict gluten-free diet for life, along with long-term monitoring for any complications, including development of other autoimmune disorders. Therefore, one should be absolutely sure about the diagnosis. Your first step is to see your family doctor. If the gluten-free diet was started recently within a month or so, the TTG blood test should be done. If it is positive, celiac disease is quite likely. If negative, it could be either that you do not have celiac disease or the test has become negative because of the gluten-free diet. In this case, or if you have been on a gluten-free diet for several months, a genetic test can be performed. Almost all people with celiac disease have one or two of these genes called HLA-DQ2 and HLA-DQ8. However, these genes are actually normal and are present in a significant portion of the general population. Therefore, if the genetic test is positive, it does not confirm celiac disease. But if it is negative, celiac disease is not a diagnostic possibility, and no further investigations are required. The genetic test can be done anytime and will not be affected by whether the person is on a gluten-free diet or not. If the genetic test is positive, confirmation of celiac disease will require an oral gluten challenge. This involves going back on a regular gluten-containing diet and having a biopsy done 4 to 6 weeks later. This will all need to be organized ahead of time with a gastroenterologist. Your family doctor will need to make those arrangements. If this all sounds a bit complicated, it is. You will need to see your doctor for more details. Please sign up at the link below so that a resource can be sent to you that can be shared with your family doctor. Also, keep visiting the website of the Canadian Celiac Association for up-to-date information on celiac disease. Thank you.